question we are often asked is whether when you injure your ACL, your anterior cruciate ligament, with a tear, partial tear, complete rupture, whether you actually need surgery or not, and whether the ACL can heal without surgery. Also, sometimes people are told that if you have surgery, it will increase your chances of having osteoarthritis earlier on. And vice versa, they also get told that if you don't have surgery, you're more likely to injure your meniscus. Now, in this video, we're going to look at what the research shows. Is there evidence for any of this? Can the ACL heal on its own? Does it increase your risk of other types of injuries or conditions? For those of you who don't know me, my name is Maryke. I'm one of the physiotherapists from sportsinjuryphysio.com, where you can get online physiotherapy assessment as well as treatment of your injuries, all done via video call. Have a look at the description of this video if you want a link to our website. Before we dive into whether you need surgery or not, it's useful to just have a quick look at what the ACL does so that you understand why there's different options under different circumstances. The ACL is one of the main stabilizing ligaments in your knee. So what it does is it stops your tibia, which is your shin bone, from shifting too far forwards on the femur, the thigh bone, and it also helps with control in rotation. Now, the most common way to injure the ACL is actually without contact. So nobody runs into you or anything like that. It's with a foot planted and you twist suddenly on it. So you'll typically be watching a football match or a soccer match and you'll see somebody just go to do a move and they collapse. And that tends to be the ACL that's injured then. Now, the best way, there are clinical tests you can do to diagnose an ACL injury, but they're not that accurate. The only way to truly know whether you've torn your ACL, your anterior cruciate ligament, is by doing an MRI scan. So what does the evidence show? Can an ACL tear actually heal by itself? Now, interestingly enough, up until recently, there wasn't any study that looked specifically at whether ACLs heal or not. They would try conservative treatment through rehab if somebody was seen as a coper, which means that you responded well to rehab, knee doesn't feel unstable anymore, and the test is good. They were seen as fine, they don't need surgery. But they weren't necessarily scanned again to check if the ACL had healed. Now, recently, 2023, a group of researchers brought out a study where they looked at, is it actually possible for the ACL to heal? So what they did was, they scanned the knees at the start. They allocated groups of people to having surgery versus trying conservative treatment first, so rehab only first, but with the option to cross over to surgery later on. And they scanned their knees at several intervals. And they found that, yeah, actually, for a large portion of people, the ACLs did grow back in this rehab group and didn't need surgery. And also, interestingly enough, at the 2-year follow-up point, the ones who showed signs of the ACL having grown back had better outcomes for function as well as pain scores in their knees. However, it's important to note that these people didn't just sit back and wait for the ACL to heal. They were following a very graded rehab plan all this time through that was specific for them and according to what their knees could do at different stages. So it's not just sitting on my bum and waiting for the ACL to heal. You have to do your rehab during that period. But also, not everybody's ACL actually healed during that time. The interesting bit was that even for some of the patients who rehab worked fine and they could get back to their normal activities, their ACLs still showed that it wasn't healed, but when they tested them with movements and things, the knee was stable. So they still didn't opt for surgery in those cases. But there was quite a large number of people also who didn't react well to rehab and did have to cross over to having surgery. So let's have a look at who actually needs surgery and who's likely to not need surgery and why that is. Let's discuss first who will likely not need surgery. So in a recent consensus study where they looked at the recent research but combined that with expert opinion from surgeons, physiotherapists and sports doctors, they came to the conclusion that you may not require surgery if it's only your ACL that's injured. So you get isolated ACL tears where the meniscus is fine, the other ligaments in the knee is fine, the cartilage is fine. Now, why is that important? Because all those other elements of the knee, like the meniscus especially, and the other ligaments, help to stabilize the knee. So if any of them are also injured, you're likely going to need surgery because the knee will be a little bit too unstable to heal by itself then. Then also, if a person completes their rehab, so these people start rehab exercise early on, and as it gets better, after about 12 weeks, they report that actually their knee feels quite stable and they don't have any giving way feelings anymore with that, then that is a good indication that they likely don't need surgery. Thirdly, there is some people, the shape of their bones are such that actually their knees are a bit more stable than others, and they tend to do pretty okay without surgery as well. Now, at this point, there's no perfect way of saying that, oh, your bones are this shape, so you definitely don't need surgery. So it's something that can inform at this point, or that we see as a reason why some people may not need surgery for it, but they can't yet predict from an MRI scan or something that you will definitely not need it because of the shape of your bones. And then fourthly, it's people who only want to get back to straight line activities. So remember, I said earlier that your ACL works hardest during rotation movements, and that's how it gets injured mostly as well, and that slipping action. So if you just want to get back to running sports or walking or cycling, then you may not actually need to have surgery because you don't put your knee under those high forces that will really strain the ACL. Now, why would you want to opt for conservative treatment versus surgery? Well, conservative treatment is actually a quicker return back to sport. If your knee copes well with the conservative treatment, reacts well to that, you can be back to sport within 12 weeks. Whereas if you have surgery, it's usually 6 months to 9 months, because people are usually only allowed to start activities like jogging at about 12 weeks after surgery. But then also, there's always risks with surgery like infection. They'll also be taking part of your hamstring tendon or your patella tendon as the graft for the ligament. So then you've got those tendons that also needs to be rehabbed, and they can sometimes give a bit more complications in the rehab process then as well. Okay, so who will likely benefit more from having surgery versus not? Well, first of all, if you've injured any of your other structures in your knee, like your meniscus or your collateral ligaments, your MCL or your LCL, you will likely benefit more from surgery versus simply conservative rehab treatment. Also, if you're one of those unlucky ones where the shape of your bones makes your knee a little bit more unstable, so it relies more on its ligament strength, you may benefit more from surgery. It definitely depends on what type of sport you want to be getting back to. If you're going to do a sport with a lot of pivoting and changing of directions, you're likely going to benefit from surgery because your knee will be stronger if you have the surgery, and you'll be able to better cope with those quick changes of direction. Then also lastly, even if you want to get back just to straight line sports, if you have completed your full or a good chunk of rehab, at least 12 weeks, and that ongoing instability is still there, so you're just walking and suddenly the knee wants to give way, then you will likely also benefit from actually having surgery and just giving that extra stability. Now, you may get it that some people mention to you that, oh no, you're going to get osteoarthritis earlier in that injured knee if you don't have surgery, or even if you do have surgery. Well, at the moment, there really isn't any research to support this. In the studies where they've looked at 5-year follow-ups or long-term follow-ups, there wasn't any difference between the people who had surgery versus conservative treatment with regards to how much their knee was worn or whether there were extra signs of early osteoarthritis. Yes, trauma to the knee of any type can increase your chances of getting early osteoarthritis, but at this point, we cannot say whether ACL surgery protects or actually hastens that process. Now, what about your meniscus? There is also the thought that if you don't have surgery for your ACL tear, that's going to cause extra strain on meniscus, and that can put it at greater risk if you go back to playing sports, that you can actually then tear your meniscus. Well, the answer to that is it really depends on your situation and what you want to be doing. If you're going to be getting back to pivoting sports, then yes, there is some evidence that you may be at greater risk of injuring your meniscus after ACL tear if you don't have surgery. But if you're only interested in straight line sports or even walking, cycling, running, those type of things, then actually the risk is quite low for getting a meniscus tear if you don't have surgery. So with all of this, the essence is that there's no hard, fast rule with regards to this. It's all about having that discussion with your surgeon and understanding what your goals are, what do you want to be able to get back to, how is your knee reacting to the rehab you're doing, is it starting to feel really stable, are you able to do complex movements without it giving way? All of those elements have to be considered when you make the choice about whether you have surgery or not. Brilliant, hope you found that useful. Now remember, if you need more help with an injury, you're welcome to consult the team via video call. The link to the website is in the description of this video. Take care.